And thank you very much for your statement this afternoon, Minister, and I welcome you to your new role. I hope you're getting to grips with the portfolio, because certainly from the shadow side of things, it's been quite a challenge taking on some new responsibilities. And I'd just like to thank my predecessor as well, James Evans, for the commitment and passion that he shared on this subject. And I hope I can do it some justice from my end of the bargain as well. So, but thanks again for your statements this afternoon. And we're speaking on this issue during Mental Health Awareness Week. So it's important that whilst addressing the challenges in mental health treatment in Wales, we also recognise our responsibility to raise awareness, remove the social stigma regarding poor mental health, and recognise that it touches everyone's life in one way or another, with 1 in 4 of us experiencing a mental health problem every year. There are also logistical challenges that I would like to address, but also areas that mental health strategies can better address. On the logistical challenges, waiting times for children's mental health supports are disgraceful. A Freedom of Information request we submitted revealed that children in Wales are waiting almost 2 years for mental health treatment. A wait of this time means that the problems these children are presenting with will significantly become more complex and difficult to address if not dealt with in a timely fashion. In the Cardiff and Vale University Health Board, someone waited 1 year and 2 months to be seen for the first time. And in Swansea Bay, someone waited 59 weeks for their first appointment. And we shouldn't be shy about the fact that this can sometimes be the difference between life and death. And some of these young people are very vulnerable. Mind Cymru have also described these figures as very concerning. Although overall those on a patient pathway waiting longer than 4 weeks for their first CAMHS appointment has been reducing, which is welcome news, but the shocking outlier cases are a concern. And not just the outliers, but follow-up appointments are a critical issue to be addressed. There are also should be some recognition of certain groups in society that are more prone to mental health challenges than others, such as those from ethnic minority communities, the elderly, the young, LGBTQ+, neurodivergent and those living in poverty. Men are also disproportionately affected by suicide, with 3/4 or 75% of all suicides being men. The unique mental health difficulties that many farmers and members of the rural communities has been raised in the Senedd before by my colleague James Evans and other members also. So there is no one-size-fits-all strategy. The care must sometimes be tailored to the needs of certain demographics, and this is something that the mental health strategy currently fails to do. Child and mental health services need the most attention, not just with the disgraceful waiting times that I have laid out, but also the Welsh Government strategy. There has been a failure to address the so-called missing middle, with a huge gulf of children in this category who do not meet the threshold for medical diagnosis or a CAMHS referral, but for whom social prescribing or community therapy is a more appropriate remedy. Many mental health experts have also highlighted that when the appropriate treatment for the children in the missing middle is provided, it will often prevent these children from developing more complex issues and becoming a CAMHS case. Also, many experts draw attention to how children's mental health treatment will be cut off at the age of 18, with resources suddenly withdrawn without the consideration of the fact that they are still a vulnerable young person with a developing brain and in need of continued support. There are also gross failings in the Swansea Bay University Health Board, who apologised after a patient absconded from a secure unit and went on to fatally attack their father in the family home. Negligence with devastating consequences. Healthcare Inspectorate Wales has consistently found and said that care and treatment plans, or CTPs, are of poor quality and not being co-produced and are not being completed in accordance with primary legislation. The proposed new mental health strategy does not do enough to identify or detail what actions need to be taken, and we need to see some new ideas from the Welsh Government. And we hear today what they are going to do to improve waiting times for children's mental health treatment, but we need to hear how the Welsh Government plan to address the missing middle, a large number of children who have sadly slipped through the net. We would like to see an independent review into all the tragic deaths of mental health patients and to see the Minister address the recommendations of the Healthcare Inspectorate Wales report. And in light of the current challenges the Welsh Government is facing with all of these issues, I think it would be appropriate to hear some contrition for the 8.8% cut to the Welsh Government's mental health budgets, which was a terrible decision at the worst possible time. I look forward to hearing your response. Thank you very much.
Diolch yn fawr, Gareth, and thank you very much for your kind words at the start, and I welcome you to your post as well. So we've both come to